the adult cardiac arrest protocol. So let's hit on the pediatric one real quick. It's not super different. So EMTs, again, you're focusing on CPR, AD early. If you don't have age-appropriate AD pads, you can use the adult pads if the patient is older than a year old. Just don't let the pads contact each other. So highly recommend, if you're going to do that, do the anterior-posterior placement. Make sure you minimize trauma scene time or scene time for trauma arrests, and consider any treatable causes like hypothermia or overdose. Make sure you request ALS intercept and manage the airway with a BVM adjunct, so OPA, MPA, and a BVM, or bond insertion airway device. So we carry the iGels here, so that'll be your biad. Advanced EMTs, you guys request a paramedic intercept, obtain IVIO access, start a 20 milliliter per kilogram crystalloid bolus, so normal saline or LR, and repeat one more time if they're still on arrest after that. You're given 0.01 milligrams per kilogram IV epi for pediatrics. If your initial pulse check with AD does not reveal a shockable rhythm, give the epi immediately. If the AD advises shock, delay the epi until after the second pulse check. And again, you just repeat it every 3 to 5 minutes. Like I said in the last video, I encourage you guys to stay toward the 5-minute mark, because we got 6 epis in the new red bag, and that'll give you about 30 minutes. So 20 minutes to work it, and some time to talk to med control and make a decision. Paramedics, make sure you document the presenting cardiac rhythm. Advanced airway management as appropriate. Consider IO access. Again, IVIO med administration is preferred over giving it down the tube. You can also consider placing NG or OG tube. We don't carry those here at Ambulance Inc. If they're in asystole or PEA, give epi 0.01 milligrams per kilogram every 35 minutes, 5 cycles of CPR, and then do your rhythm check. If they're in asystole, continue epi and CPR. If they're in VFib or pulseless VTAC, defibrillate at 2 joules per kilo, deliver 5 cycles of CPR and recheck the rhythm. If still shockable, defibrillate at 4 joules per kilo, go through epi or go through CPR again, give epi. Consider amiodarone, lidocaine, mag sulfate. The dose for amio is going to be 5 milligrams per kilogram with a max of 300, and then lidocaine is going to be 1 milligram per kilogram. We don't carry mag here, so I'm not going to really hit on that. Consider treatable causes, so hyperkalemia, hypothermia, anything like that. Treat. It does note that if it's a known tricyclic antidepressant overdose, then you can consider bicarb 1 milliequivalent per kilogram IV push. That also goes for suspected or known hyperkalemia, so a dialysis patient. For post-resuscitation hypotension, 20 milliliter per kilogram crystalloid bolus, up to a total of 60 milliliters per kilogram. And then if they're still hypotensive after that, you can do some PEDS push dose epi, which is 1 to 2 mics per kilo.